Hi, my name is Dr. Michael Smith, and I'm a pediatrician here at 1005 Pediatrics. The pediatric topic that I'm going to discuss today is vomiting. Vomiting is defined as the forceful ejection of stomach contents, or forceful, spitting out of stomach contents. This is different from spitting up, because spitting up is usually in the newborn period, although it can happen later on, and is usually not as forceful. There are many causes of vomiting. Some of them are serious causes, and some of them are not harmful or worrisome at all. So hopefully today in this talk I'll be able to help you differentiate those a little bit. We're going to ask you, if you call us about vomiting, to note for us a few things, or come visit us in the office. You'll note a few different things. We're going to ask you about the color of the vomiting, the frequency. In other words, is it happening many, many times, or is it just a couple of times in a day? Also with vomiting, we're going to want to know, are there other symptoms that go along with it, such as fever, cough, fast breathing, and vomiting could suggest something like a pneumonia. Diarrhea and vomiting could just be a stomach virus. Fever, sore throat, and vomiting could suggest strep. So the symptoms that go along with the vomiting can give us a better idea of what's going on with the child. Also, we'll ask you when you come to visit us in the office or over the phone if your child is urinating or able to keep down fluids, because these help give us clues as to how well hydrated your baby or your child is. There are some things that need to be evaluated urgently or emergently. These are really forceful or projectile vomiting in newborns in the first couple of months of life after almost every or all feedings. That's something that we want to know about right away. Any dark green colored vomiting, the other word for that is bilious vomiting. It has to be dark green in color, and if we see that, that's something we want to know about right away. Blood in the vomiting is also something that we're going to want to know about right away, and if you have an ability to tell us how much blood in the vomiting, that's something that would be helpful as well. A teeny tiny streak of blood might not be so worrisome, but a cup full of blood is much more problematic. Or if your child isn't able to keep down any fluids at all. Those are things we need to know about right away. Most commonly, a child has vomiting with or without diarrhea, and it can be attributed to something like a stomach virus. These kids are able to keep down fluids, but they're uncomfortable, and hydrating kids can be a challenge. So what I wanted to discuss with you is a good way of keeping kids and babies hydrated to make sure that they don't become dehydrated when they're not able to keep very much food down. Most of the time these kids can be hydrated orally. And the way we do that is usually after the last time of vomiting, you'll rest their stomach for 1 hour. No food or drink, nothing. Just rest for 1 hour. And then you're going to start with either some water or Pedialyte. Pedialyte works well because there's a little bit of sugar, and some kids with who aren't eating very much can get low blood sugar, so we want to make sure that a little bit of sugar in their fluids, either from Pedialyte or perhaps watered down juice, might be beneficial. You're going to start with 1 teaspoon every 10 minutes, no more. If you do more than a teaspoon, kids can sometimes vomit after that. So 1 teaspoon every 10 minutes for an hour. If they want more, don't give it to them. After 1 hour, go up to 2 teaspoons every 10 minutes. And you can keep ramping up every hour a slightly bigger amount of fluids. If you can go 4 hours without vomiting, then you can try some solid foods. But don't go get a big steak dinner. Try with just a small little bite of a cracker, maybe a spoonful of applesauce, once again every 10 minutes. The idea is that we're trying to trick the stomach into thinking it's not getting anything in there, even though we are getting small little sips and small little bites. Most of the time, the things that cure vomiting the best is just bowel rest. Bowel rest and time are the best things for stomach viruses and garden variety vomiting. If a child vomits before that 4 hours of giving solid foods, that's okay. It's okay, it's natural. Just rest your stomach 1 hour and then try again. If every time you rest the stomach an hour, the child vomits right after that, I want you to give us a call because that might be a sign that the baby or child is going to get dehydrated a little bit faster. And so that's something that we can help guide you with. If you've made it to 4 hours and the child is keeping down even a little bit of solid foods, that's usually a good sign. In a garden variety of stomach virus, vomiting can last on average about 12 to 24 hours, followed by diarrhea that can last on average about 3 to 5 days. Unfortunately, there are no cures for stomach viruses. It's something that has to pass on its own. Things to avoid that make vomiting and potentially stomach viruses or diarrhea worse. Dairy products in about half of kids can make vomiting and diarrhea worse, so we'll tell you to stay away from them. Juices, especially straight juices, can make vomiting or diarrhea worse, so we tell you to stay away from those as well. And I tell people to avoid things with red food coloring, like red Gatorade or other things, because if a child vomits and it's red, we're going to be concerned that it's blood, even though it might just be food coloring, so it confuses us. Let's talk about signs of dehydration. Signs of dehydration are the following. A really, really fast heart rate, which you might not always be able to detect at home, but if you put your hand over the child's heart, or if you know how to take a pulse and their pulse is racing, I want you to call us. If the child opens their mouth and you notice that it looks like someone dried out their mouth with a paper towel, that's another sign that, that the child or baby could be dehydrated. Also, fewer than 3 times wet diapers or fewer than 3 urine episodes in a 24-hour period could be a sign that the child is dehydrated. Or when they cry and you don't see any tears developing, that's another sign. The other sign that I usually teach people, although it might be hard to see in this video, is if you blanch your finger, take away the color, and then slowly let the color go back. If it comes back rapidly in less than 2 seconds, that's called a brisk capillary refill, and that means that the child is probably decently hydrated. If it comes back slowly, it could be a sign that the child is starting to get dehydrated. If there are signs of dehydration, you're certainly welcome to call us in the office, but most likely we'll tell you to go to the emergency room if they're not able to keep down fluids, or if there's signs of dehydration, because they can help hydrate you faster in the emergency room with IV fluids. In short, vomiting is not something that you have to be worried about, and most of the time, in overwhelming majority of cases, babies do really well with it, and they tolerate it very nicely. And with just some small tweaks in their diet and fluid intake, you're able to keep babies well hydrated. And if you do see some of those warning signs, please give us a call and we can help you as to what to do next to help your child be safe. Thank you very much.